Good evening, ladies and gentlemen. Today we're going to talk about treating autism and what you can do to treat an established case of autism. There's a bunch of things you can do, so we'll get started right away with the list of things you can do to treat autism. The first thing being sulfurine, which is derived from broccoli sprout extract. And here the abhorrent behavior checklist, there was a 34% improvement when sulfurane was supplemented. In the social responsiveness scale, there was a 17% improvement. Another thing you can do is supplementing L-carnitine leads to an 18% improvement in humans with autism, though 5% was placebo. And then another thing you can do is raw camel milk led to a 10% improvement in symptoms. Omega-3s. So omega-3s are important. They gave this 15 milliliter liquid twice daily, which consisted of 1 gram a day of omega-3 fatty acids, which was fish oil. And they also gave primrose oil, arachidonic acid, and gamma-linolenic acid, and 60 milligrams of vitamin E, and 3 milligrams of thyme oil for 12 weeks. Supplementing these omega-3s led to a 25% reduction in symptoms. So you can consider supplementing with omega-3s. That might help. And they also did some antioxidants in there, so you might want to try some antioxidants too. Neuroprotect, it's a supplement that contains lutein, quercetin, glycoside, rutin, and it's specially packaged in a lipid complex to be more easily absorbed. And 30 to 50% of patients showed significant improvement in retained learned tasks and social interactions. Surprisingly, 10% of children started to speak again. And then another study with the same Neuroprotect kind of supplement saw a reduction of 26 to 34% in the abhorrent behavior checklist subscale scores. So lutein, quercetin, and quercetin glycoside rutin in this Neuroprotect product really showed some benefits. Diet. So diet is especially important. The overall benefit of diet was a moderate to high benefit of 2.36 from a scale from 0 to 4. So it's better than mid-range. It's between mid-range and high range in terms of how effective it was. It was better than nutraceuticals in this study, and better than seizure or psychiatric medications also. So diet was the most effective, followed by nutraceuticals, followed by psychiatric and seizure medications. The average overall adverse effects of diet was also much lower, so 0.1 versus 0.93 for medications. And it was also similar to nutraceuticals, so nutraceuticals didn't have many side effects either. Autism severity decreased over time in participants who used diet versus increasing in those who did not use diet. Quote, healthy diet was most effective, and a gluten-free diet had the least positive impact in this study. Though if you look at the study's carve-outs, they carved out keto diet too and looked at just specifically the keto diet. And in their graphs, the keto diet appeared to be best, though in their write-up they said the healthy diet was best. So you might want to try a keto diet, or you might want to just go with the healthy diet. Both are very effective as far as I can tell. spore-based probiotics. So you can get a spore-based probiotic, and it can cure food intolerances in autistic children. Autistic children are often hyperreactive to foods, so you might want to try a spore-based probiotic to try and reduce that hyperreactivity to food. And now there was a twin study where both twins had autism, though one had autism more severely than the other twin. And autism was successfully reversed. So this is an example of taking these sulforanes, these diets, these L-carnitines, these omega-3s, and applying them into practice. And they used multi-modality interventions starting at 20 months of age, so about 2 years of age, right after they were diagnosed with autism. They focused on a clean diet, individualized nutrition. So they tested for things that their body might need, and then they gave them the body's requirements. They did some supplements. They did toxin reduction, which is important. They did some genetic analysis and looked at the genes and tried to figure out what could be used to mitigate any genetic deficiencies or abnormalities. And they used speech therapy, cranial sacral massage therapy, homeopathy, just everything they could think of. They threw it at their children using an approach I like, which is do everything you can to try and mitigate the problem, which is be it a mental health problem or a different kind of problem. And they were reevaluated at 36 months. So they were reevaluated at 3 years of age. And a child had a 55% reduction in symptoms, which is great. A 42-point reduction in the ATAC score. But they still met DSM-5 criteria for autism after treatment. So the one kid had a substantial decrease in symptoms. Over half of their symptoms disappeared. They still, however, met the criteria for an autism diagnosis. And then there was a 91% reduction in symptoms in the other child. A 39% reduction in ATAC score. So the other child no longer had a diagnosis of autism. And if you want, you can read up about the study. All the links are below. So I should add, if you want to not watch all this verbiage and just read it, you can go down into the links below and read about how to successfully treat your child who may have autism. So here's some other things you can do. Supplementing selenium leads to a 40% improvement in autism, albeit it was in a mice model. So selenium, if you're deficient in selenium, supplementing it might help, though again, it was only studied in a mice model of autism. Korean red ginseng in a mouse model completely normalized the mice who had autism, so you could try some red ginseng. Licorice in a rat model helps, but it didn't help a ton. So, and then acupuncture seems to help, and I haven't figured out the effect sizes of that yet, but I should look into that more. But autism does seem to be helped by acupuncture. And then another thing you can do is nonverbal autistic children can sometimes communicate using spelling boards or other less dexterous means of communication than the tongue. Sometimes they have difficulty maneuvering the tongue properly, and if you give them a spelling board, sometimes they can communicate okay. So, thank you very much for watching. I hope you found this informative. I hope it gave you some ideas for what you can do to try and cure your child from a diagnosis of autism. I will note that sometimes kids grow out of autism too. So from a young age, they might be struggling to speak, but sometimes as they get older, they develop speech and they grow out of the autistic diagnosis, though sometimes, often they still have some, they're more technical aptitude than artistic aptitude, or as kind of an Asperger's syndrome sort of thing. But thank you for watching, and I hope this presentation you found enjoyable. Don't forget to like, share, subscribe, comment down below. I always appreciate comments, and I will let you go. So have a good day.